Welcome back to Holistic Healthline, your direct line to great health. And we were just talking about heart disease, which is the leading cause of death for men and women, especially for aging baby boomers. About 610,000 people die of heart disease every year, and that's one in every 4 deaths. That's pretty significant. And so we have, as our guest today, expert Dr. Jim LaValle is a clinical pharmacist and board-certified clinical nutritionist. He's here to talk about cardiovascular disease as well as the ways to prevent heart disease, and in particular, the silent epidemic of hypertension, also known as high blood pressure. Hi, Jim. Welcome back to Holistic Healthline.
Hey, good to be here.
We were talking earlier about how, particularly for women, heart disease doesn't seem to be as promoted as it should be, that it is the number one killer of women.
I think it's shocking that we're not literally lining people up and making them do their blood pressure. Honestly, it doesn't hurt. It's an easy test to do, and it's one of your big indicators that you're going to be at risk. And we don't realize that more women die of heart disease than men. We think it's a man's problem, and it really isn't. It's a non-discriminating problem. And you have to remember that basically half of all people over the age of 50 in the U.S. Have hypertension. So a third of all adults, half of all people over the age of 50.
There's probably a lot of things that we could do without drugs, without blood pressure medications and cholesterol, statin drugs, and the whole thing. There's probably a whole lot we could do to prevent this, right?
Yeah, absolutely. I think there's so many things that we're not doing that, for example, walking. If you can walk 45 minutes, 5 days a week, that would have an incredible impact on people's blood pressures. And people need to move more, and they simply aren't exercising in general the way they should. And if they are exercising, a lot of times everybody's doing higher intensity exercise and not the simple act of walking at a brisk pace, and that can have a tremendous impact. Obviously, one of the biggest things that cause this issue is insulin resistance. So when people's diets are rich in sugar, rich in refined carbohydrates, not getting enough vegetables, the blood vessels get stiff. They get stiff, they get sticky, your blood gets sticky, and it puts you at a higher risk. And, one of the big nutrient deficiencies that relate to hypertension is magnesium. And, dark leafy greens, it's really important for people to, get those dark leafy greens in. And so and then manage your stress, right? There's several things people can do, but it really does start with a commitment to changing your lifestyle. And even more importantly, at least knowing your blood pressure. And a lot of people don't even know what their blood pressure is, and it is the silent killer. That's what it's called. People's blood pressures can be very high, and they don't even realize it.
And it's a simple thing. You can go into the local department store and get a blood pressure machine for $30. Right. The technology's gotten better, so they're actually fairly accurate, and they're cheap.
Exactly. And I like people getting morning and night blood pressures. If you have your own machine, if you do a morning and an evening blood pressure, that's really good because it tells you whether or not your body's adapting to the night hours, or if your blood pressures are going up at night, it means that your stress hormones are loading in you. So it's really good if people get a machine, they start to measure their blood pressure and find out how they're adapting to stress. And then they have to look at their heart rate, too, because heart rate's really important as another aspect of what's going on with your blood pressure.
And I always suggest to them to, at some point, get their machine checked against what their doctor is getting. because some people need to get, if they've had a machine for a while, need to get them calibrated again, just so that you're getting accurate information. And to, check it maybe a couple of times a week, unless you got a problem going on, because obsessing about the blood pressure is also going to cause that blood pressure to go up. So we got to be a little balanced about it. But as far as supplementation, is there any particular supplement, if you had to pick out one that you would go, okay, this is something that is a key nutrient that people need to have in their diet on a regular basis? Is there any one particular one that you would focus on?
Well, once you get past what I'd call more essential nutrients like magnesium and omega-3 fish oils, the number one thing by far, the most proven, multiple studies on it for blood pressure. And honestly, in the natural product category, there's not a lot of products that reach that level where they've had multiple studies on blood pressure. It's aged garlic extract. So Kyolic actually has multiple human trials where people have, that their systolic blood pressure is dropped, which is the top number, 11 points on average, and their diastolic drops about 6 points, and it has other benefits. So I really like Kyolic aged garlic. They have a blood pressure formula, very interesting compound. They've got a circulation formula, and so I think if you looked at even people who have what's called resistant hypertension, they are on a couple meds and their blood pressures are still a little high. Aged garlic's actually shown that even in people who are on medication already and are having trouble regulating their blood pressure, that it actually helps to bring that blood pressure down too. And that's pretty breakthrough because, it brings blood pressure down in many cases as much as some drugs.
It's amazing, an amazing product. We've been doing this for so many years, and you come across so many different supplement companies and so many different products. This Kyolic aged garlic, I mean, you see significant changes in, as you said, blood pressure. Cholesterol comes down. Blood sugar comes down. I mean, it's actually amazing how well it works for how many different things.
Now, Jim, Peter said there's a lot of other companies out there that are putting out garlic products, or some people are taking, cloves of garlic and swallowing them that way. Are they going to get the same benefits as the aged garlic extract that Kyolic makes?
Yeah, that's a great question. I mean, the reality is swallowing cloves of garlic, while, some people like doing that, that's fine. You don't get the same benefit from garlic capsules, garlic tablets, eating garlic, as you do when you take aged garlic. Because when they age it, it changes the chemical properties. Just completely transforms it to new natural compounds. But they really, in the manufacturing process, they're measuring it to make sure that when you buy a bottle of aged garlic, that you're getting those natural compounds. So there's actually quite a bit of quality control and science behind making that final product, that 20-month aging process, where all the volatile compounds that kind of give you the stinking rose effect. So, when people take garlic cloves, a lot of times, you can tell they've been taking garlic cloves, right? They reach with garlic.
Yeah, you got to stand a few.
You can tell what you've been eating.
You stand a few
Italian
feet
last
away,
night or what, right? So when you age garlic, it removes those volatile compounds. And the other thing that's interesting, there's a couple other interesting things. One, they found out that it actually acts as a prebiotic and helps with improving diversity of the gut flora, which has been tied to cardiovascular health, so improving the gut flora. They showed that in the last hypertension study, actually, that in addition to blood pressure lowering, there was an improvement in diversity of the gut flora. And then another breakthrough study was using it in periodontal inflammation And in that study, they showed a significant reduction in periodontal disease. And because a lot of people don't realize, if you're not taking care of your teeth, that's a big risk factor for heart disease. You're gonna inflame your arteries and plaque them if you're not taking care of the plaque on your teeth. And aged garlic actually helped to reduce the bleeding and the inflammation in the gums. So really incredible, kind of a global cardiovascular health impact. That's what we're finding out with the research with aged garlic extract.
Jim, we got to take a quick break, and we can get back. Well, I want to go a little bit into some of the specifics. For instance, like the Kyolic aged garlic extract has, like, with the Formula 109 blood pressure formula, has the nattokinase, and, you know, why are they putting some of these things in there? I'm going to take a quick break. Our special guest today is Dr. Jim LaValle, again, clinical pharmacist and board-certified clinical nutritionist. We'll be back in a moment with Holistic Healthline, your direct line to great health. And welcome back to Holistic Healthline, your direct line to great health. And our guest, Dr. Jim LaValle, who is a clinical pharmacist and board-certified clinical nutritionist. Swell guy, amazing brain. We call him the brain. You know, that's just how good he is.
A gentleman and a scholar.
Stop. No.
The aged garlic extract, the Kyolic 109 blood pressure formula, we have been using for a long time. I would say it is the most, the one that we recommend the most, but also
it's the only one we have on the shelf
that people come in for specifically for blood pressure, and their doctors are always amazed at how much better their blood pressure gets after they've been on it a while. Now, what is in this aged garlic extract besides that? What else is in the Kyolic 109 formula that helps blood pressure?
Right, nattokinase. So natto's interesting. It's another fermentation that develops a lot of vitamin K2. So real rich in vitamin K2, and vitamin K2 is great because it really helps with your arteries to make them more pliable and stop calcification. It makes your blood less sticky. And then the other one is suntheanine. And so suntheanine, what the great thing about theanine is, look, a lot of people end up with hypertension or early hypertension because they're stressed out. And theanine is one of those great compounds that really helps people to feel more calm. And there's good studies on theanine helping to lower blood pressure as well. So when you look at the three of those ingredients together, once again, really causes a nice kind of global approach to trying to help you do something with your blood pressure naturally as your first line of defense. And I would really invite people, if your blood pressure is starting to creep up, do everything you can. I mean, change your diet. Get out there and exercise. Get Formula 109. Get some magnesium on board. Because when people get on medication for blood pressure, a lot of times they don't like it. They don't feel well on it. But you kind of got to be on it at that point if you're not taking care of yourself.
And particularly for men, a lot of them have issues with, ED, and they don't like that side effect either. As far as you hear all the time doctors talking about cholesterol and wanting to put people on the statin drugs, does the aged garlic extract also affect cholesterol levels?
Well, it's one of the earliest findings that they had. What's interesting about it is, now we're kind of looking at cholesterol and going, all right, it's one thing if you got too much cholesterol, but if it's oxidized and if your fractions of what's called lipoproteins are elevated, you are really starting to mess up your arteries. And not only does aged garlic extract improve your cholesterol profile, but it also reduces what's called oxidized LDL cholesterol. And oxidized LDL cholesterol is rusted, basically. Oxidized is rusted cholesterol. It's the cholesterol that plaques your arteries. And it lowers it as much as 88%. I mean, that's There's no drug that does that. So aged garlic really, in addition to its ability to improve your cholesterol levels, kind of this blanket approach, all these little really meaningful markers that add up to more trouble with your future risk for heart disease, it absolutely targets those too. So it's really fascinating. I mean, I got to be honest, I haven't seen a natural compound like aged garlic ever. Something that studied so much, over 850 publications, and such a diverse mechanism of action that really helps people, and people tolerate it. How often do you have somebody come in and go, "Oh, it didn't sit well with me"?
Right.
I never have anybody.
Right.
So I think it's awesome.
And so basically what's happening is not only you preventing plaque buildup and garbage building up in the pipes, your arteries, you're actually reversing the process and helping to slowly help that rust to kind of go away.
That's exactly right, because it's even regressed vulnerable plaque. So that hasn't been proven on any other dietary supplement. So it actually regresses, reduces vulnerable plaque that's already been developed in your arteries.
I see. We see patients as you do, and I'm sure you get the same experience that we have. So many, particularly older patients, taking the drugstore multivitamin, the one that's got everything from A to Z, and I'm like, throw that thing out the window and take the Kyolic garlic, because you're going to get so much more. You're going to feel better with that Kyolic. Nobody ever actually feels better on that dumb multi.
Yeah, I think it's probably for today. Like in today's world, I think it's the single most important nutrient you can take. I'd probably put magnesium up there with it, but most people, would be great if they could eat enough greens that they would get their magnesium. But I guess I'm in Oz or something thinking that, because it's very hard for me to get people to get enough vegetables in. I got to harp at them.
Now, what we usually recommend to our patients is to, depending on where their blood pressure is, but usually start them off with the Kyolic 109 formula at 2 capsules twice a day. Is that something that you found to be beneficial?
Yeah, that's the dose that works really well, and you can always add a little more. So in a few of the studies, they got up to 3.6 grams of aged garlic extract a day. So you can do Formula 109, 2 capsules twice a day, and then you could always get the Formula 100 and add a couple more capsules of aged garlic to your program with no concern. I mean, there's plenty of studies up to the 3.6 grams per day dosing now, so that you started 2 caps twice a day, and then move up if you need to. But if you get great benefits at that starting dose, just stay right there.
Are they finding extra benefits with the higher dose?
Well, some of them, that was the periodontal disease study, was at 3.6. The microbiome study was at 3.6. So they are seeing some extra benefit. But once again, there's studies at 1,200 milligrams a day showing benefit for blood pressure.
Yeah.
So, a lot of people are on a budget.
Sure.
Start with the minimum dose. See how you do.
And we've also found the Kyolic blood sugar balancing formula to be, again, you mentioned earlier, as blood sugars, people eating way too many carbohydrates and sugars, that is problematic, that in combination with the Kyolic 109, the Kyolic blood sugar balance formula, the two of them together is solving a lot of problems.
Yeah, that's a good call. That's really smart, because a lot of blood pressure problems are occurring because people are insulin resistant. You got 38% of the U.S. population is insulin resistant, so they're going to have blood pressure problems. As soon as your insulin goes up, you make more adrenaline, your blood vessels get clamped down, and now you got to push harder to get that blood to get through those blood vessels. So yeah, that's a really good suggestion.
You can steal it.
Jim,
Look who's got the brains now.
Jim, we want to thank you so much for joining us. And unfortunately, we've run out of time. You're always a wealth of information. And for people, go to Kyolic.com. Check it out. You can go to your local health food store. Look on, the websites and check out the many different formulas. But thank you so much, Jim. I think we lost him.
Nope.
Okay.
Okay. Thanks, Jim.